Hi again. Welcome to our Pharmacokinetics of CBD talk. We are addressing the medical professionals, and we are here with Dr. Blair. Welcome, Dr. Blair.
Well, hi, Christy. It's great to be here again and to talk with you about this important subject, but it can get technical, and I'd like to share some of my ideas about it. It's good to be with the providers and people who are involved in the therapeutic use of the cannabinoids, and I welcome you all.
Me too. Welcome. Well, let's get started. First, I'd love to introduce Dr. Blair to all of you. Some of you know him, some of you don't. He is a retired Army doctor, a graduate of West Point in 1972 and the University of Miami in 1978. Currently, he is the president of Pro Health Advisors and Elixinol's senior medical director. He is definitely invaluable to us. Anything you would like to add to that, Dr. Blair?
Well, I would like to say sort of how I got into this area. You know, I spent 40 years in medicine, and I haven't been terribly pleased with the benefits from regular medicine. Certainly, we've done a lot of good with the standard medical approach, but the contemporary practice of medicine, I think, there's a lot of gaps. And what we're seeing is an epidemic in a number of different diseases that we haven't been really very well to address. And so I think that it's possible that the endocannabinoid system and some of the phytocannabinoids like cannabidiol could be extremely valuable in helping these patients in whatever therapies are involved. And I think it's important too, Christy, that as we're talking to these other healthcare professionals, that we're talking about things that cannabidiol is a supplement. It can be incorporated into what they're doing and integrated in their approach. And so that's the major theme that I have with this as we talk about some of the elements and aspects of CBD and how it can be integrated into therapies that many of the professionals are already doing.
This is good because a lot of times people are doing things right, and our medical professionals are doing everything right. And in my personal and professional opinion, CBD is a missing link in a lot of therapies, and I think we'll go into a little bit more detail.
Right. So let's talk about what we're going to cover today, Christy, because we've got a lot of material to go over, and I wish I could get to and go into detail on each one of these things, but we want to keep the talk relatively confined. So what we will discuss today is a little bit of the chemical structure and some of the action that CBD has, the information about absorption and metabolism, some of the mechanisms that are involved, although we won't be able to get too far into the details here. Some of discussion about the adverse effects that are minor and limited, and something about the toxicity, which isn't there, and the interactions, which are rare. So those are going to be pretty easy to cover. And then I want to tell you a little bit about how you can use cannabidiol in an effective program.
Oh, wonderful.
So first of all, when we're talking about chemical structure, certainly CBD is a cannabinoid, but it also belongs to the class of terpenes. And terpenes are actually aromatic hydrocarbons. And those are the ones that smell so good in the biochemistry laboratory. They're terrific, but they also represent a lot of the substances that really are exciting to smell. Things like the lemon, and lime and many of these other substances, they are exciting to smell. And if you're familiar with essential oils, they're also involved with that. So the terpenes play a major role. And what's pretty neat is that the cannabidiol interacts with those in a very positive way, the other terpenes. In fact, in the cannabis plant, there are as many as 120 different terpenes that are located that are in the molecule and the extracts that come from it, and they play no small part in the benefits that come from cannabidiol. Now, this molecule is lipid soluble, I'm sorry, Christy?
Oh, no, go ahead. Well, I wanted to ask are the terpenes, do they have a beneficial effect on the immune system too? Heard that.
Yes, if you start to look into this a little bit deeper, you'll find that many of the cannabinoids have specific benefits outside of the cannabinoid system completely, and they're using other mechanisms. And that's probably why cannabidiol is also working outside of the endocannabinoid system, working on other triggers and mechanisms within the body. And so, just like essential oils, one of the ways you can look at it is cannabidiol is an essential oil.
Oh my gosh, this is amazing because essential oils are hot and people are using them and people are having great benefits with them. On this slide, you mentioned degradation and elimination. What do you mean by that?
Well, when you get it into your body, what do you do with it? How do you get rid of it once it gets in? And one of the important things to notice to know is that it's going to go through the liver and it has to get degraded and it's going to be broken down. And the liver does all of that, and then it's excreted through different mechanisms. But primarily, it's the liver that's metabolizing this stuff. So anything that you can do to prevent that metabolism or decrease it or slow it down, you're going to have improved endurance, duration of effect from using the cannabidiol and the other cannabinoids for that matter. But I want to mention this is a fat molecule, so it's going to dissolve in fat, but it has very poor water solubility. So you're not going to be able to mix it well with water. Now, there is a product that's an exception to that that's been wrapped with a phosphate skin, and so that becomes water soluble. But by and large, this molecule is not going to be water soluble. And then I wanted to show this slide represents the comparison. We're really only talking about between THC and CBD. We're only talking about one bonding, one chemical change. So they're very, very similar, but that's specific enough to make this conformational change that makes CBD fit uniquely into some areas and THC into other areas and activate different receptor systems.
So CBD is not psychoactive, correct?
That's right. There's no psychoactivity to it, at least in the terms of making you high or making you uncomfortable or hallucinations like that. And so absolutely, there is no psychoactive effect for the cannabidiol.
Dr. Blair, a lot of people ask me if they absorb the cannabinoids and there's a saturation point. Do cannabinoids like CBD stay in our system, or do we clear them after a certain amount of time?
Well, it turns out that the cannabidiol isn't so well absorbed, and a lot of it gets eaten up by the liver and through the first pass effect. But when it does get into the body, it's really widely distributed. A normal person gets it, goes all over the body, and because it's fat soluble, then it's going to go into the fat tissue, and it's going to be absorbed into the fat and that we have all around their bodies. And so there's really a very wide distribution. In terms of saturation, we just don't know enough about the long-term effects to really answer that. There really haven't been any cases where people have had difficulty with that or any problems. There is a small number of people who don't really respond to the cannabidiol. So that's disappointing. And why that is, I don't know the answer to that. I think there's some number of theories that go on with it.
Well, let's talk about this slide. It only gets better when we're talking about cannabidiol and the endocannabinoid system.
So when we're taking it orally and you're bringing the cannabidiol CBD in orally, it's only about anywhere between 10 and 20% bioavailable. A lot of that may be due to the liver metabolism, the first pass effect. But still, there's quite a bit of degradation. You can improve the bioavailability by taking it in through the mucous membranes because you don't get that initial first pass effect with it. And it goes straight into the bloodstream and you can get those immediate effects. That's pretty good. And so when you just keep it in your mouth for a period of time, about 5 minutes is generally sufficient. And a lot of people say under the tongue, but it can really be kept anywhere in the mouth. And I recommend swishing it around the mouth if you can tolerate the taste and the flavor, which isn't really very, very difficult or challenging. And just encourage people to hold it like that.
Okay.
The onset of action, if you're taking it in sublingually or oral by absorbing it through the mucous membranes, then you're going to get onset of action within a couple minutes. And a lot of the effects occur within 5 or 10 minutes. If you're taking it orally, as if it were in a capsule, then there is some delay in terms of feeling that effect and getting the benefits. And so it may be as long as 1 or 2 hours before people are going to feel the onset of those particular benefits and the improvements that come on with the CBD. And then the duration also changes depending on how it's brought in. If it's coming in submucosally or sublingually, then you're going to get immediate effects, and about 6 hours. But if you're taking it in with a capsule, we are getting a longer duration, anywhere between 8 and 12 hours using the capsule form.
Wow. What about vaping? That seems to be kind of up in the buzz of vaping CBD. Are there benefits to vaping CBD versus through the mucous membranes?
Well, vaping is probably the most effective way to get CBD into the body. The absorption through the lungs and through breathing is really quite quite special. We're talking about on the order of 90% is actually absorbed that way. So when 1 molecule or 1 milligram of CBD is really, really well absorbed.
Wow.
The problem is that in terms of products that are available and what people are using, that can be a challenge in sorting that out. And there's not as much standardization of those particular methods. Yes, it's more bioavailable, but it's also less consistent in terms of its the dosing and the use of it. So with regard to the mechanisms that are involved, what we're seeing with the endocannabinoid system, certainly it's involved with the endocannabinoid system, but there's much, much more involved in the mechanisms. There are ways that CBD can interact with cell membranes, with the nucleus of the cell, and with other organelles like mitochondria, the Golgi apparatus, as well as the endoplasmic reticulum. All of these areas are affected by CBD. Now, CBD can work as an agonism, in agonism as an activator molecule, or as an antagonist, as a blocking substance. In addition, there are sort of fine-tuning. The antagonism and the blocking can be a reverse antagonism, which is double speak for meaning that it prevents other things from connecting into the molecule and providing effects. In addition, the CBD also works as a heterodimer. And what that means is that in combination with other substances, it affects the molecules like opioids in a very positive way in reducing some of the adverse effects and enhancing the effectiveness of these other substances. And the heterodimer is actually a shared agonism, so that 2 molecules are connected up. And it turns out that the CBD is working to enhance the other receptor in terms of its function. It's a really cool effect that's just being understood right now, and there's a number of these heterodimers that are actually occurring within the body with CBD. So let's get on to some of the adverse effects, because this is my favorite part, because there aren't any. Any of the side effects that occur and the adverse effects that occur with CBD are really minor and quite limited. I have seen people get very tired and very fatigued by using CBD, but just easily fixing that by reducing the dose. The other thing that people will have occasionally is vivid dreaming. There's no question that CBD affects sleep, generally in a very, very positive way by improving the depth of sleep and changing the pattern of sleep so that less time is spent in the dream state. So the REM sleep is not so much, but the deeper sleep is also improved. And so that people may not sleep longer hours, but they do sleep deeper and more effectively and get better rest with that. Now, when we're talking about toxicity, there's never been any toxicity shown with CBD. None, zero. And then a lot of people ask, well, what about tolerance? Does the benefits and those things go away with time? Actually, we're not seeing that. Consistently, the CBD has no tolerance effects, or you don't get adjusted or used to it. In fact, it may be the reverse, where as Christy suggested earlier, if you build this up in your system and you do get it saturated within the body, that it may have the role of being able to reduce the dosage a couple months out so that you're only taking a small proportion, perhaps just a quarter of what you were taking for the effects, the initial effects, and finding continued benefit. So that's a really good feature that it'll be good for your pocketbook. And then some people often ask about withdrawal. There is no withdrawal. I'm not seeing any ill effects from this. In fact, it seems to block withdrawal from other substances too. That includes opioids and some of the benzodiazepines. So it seems to have a protective role in those conditions as well, and protecting against the withdrawal effects. Now, if we look at drug interactions, these are rare, and everybody's asking me about the drug interactions. There's a lot of theoretical interactions that could occur, but I'm just not seeing those in practice. And most of my clients and the ones that I work with are interested in getting off of the drugs that they're on. So if I instruct them, if you're getting side effects, look at the other medications or other substances that you're taking to see if they might be causing some of the effects. And if they are, reduce the dosage on those. And that's the general guidelines. And that's been consistent for a broad range of conditions and for potential drug interactions. There are a couple that occur with epilepsy, and frankly, it's highly variable in the patient. So there's no consistent pattern with this. You can't really trust the degradation pathway as being where the CBD is involved in the cytochrome system in one particular pathway and another drug is involved with it. You say, oh, there's going to be an interaction. That just hasn't been reported in the large majority of cases. And then one other thing I want to talk about is coagulation. Everybody's always concerned about coagulation, especially for those people who are on anticoagulants. Not an issue. I've never seen any difficulties with this. No one has come back to me with any major change in coagulation as a result of using CBD. Christy, you're going to have to turn your microphone on. So I'm going to talk about CBD enhancement next in the next slide. So Christy, you had a question?
Yes, about the drug interaction. Sorry, I thought you were in control of my mic. A lot of people take CBD who have cancer, and they want to know if they can do chemo and use CBD at the same time.
Oh, by all means. I encourage people to use the chemo because one of the features of CBD is that it enhances the effectiveness of those chemotherapeutic agents. It makes them work better, but it also protects the normal cells. So it enhances the killing effect, but it protects the normal tissues. So the potential is you're going to get your best results from using this in combination. In addition, the benefits from using cannabidiol in cancer therapy is that you're going to get alleviation of pain, you're going to have reduction of nausea or vomiting, and some of the other complications that typically occur with chemotherapy in the gut can be greatly reduced by using CBD at the same time. So I encourage that primarily that people use the CBD. And that goes for radiation, and it also goes for surgery.
Wow. Okay. So even if their doctor says get off all your supplements, which of course they do, CBD is safe to take pre and post surgeries in with cancer
Well,
treatments.
I've never seen any complications from it. I'm not going to defy another doctor who's involved with their primary care that's being taking place. But I do want to encourage them that there haven't been any adverse effects. There's been no problems with it, and I've only seen enhancement of the benefits by using CBD in whether it's a surgical process, a chemo, or a radiation process. So it's all positive, but always there are outliers and potential problems that the usual disclaimer that we have to have, especially if I'm not involved with the care of the patient.
Yes, thank you.
So let's talk about these other things that you as healthcare providers are doing, the things with the lifestyle changes, the diet, exercise, and sleep. These are important endocannabinoid enhancers. We talked about that last time. They have very positive effects. And these other things also have strong positive effects. And probably the way they're working in the body is through the endocannabinoid system, the acupuncture, massage, meditation, and osteopathic manipulation. There are documented major improvements and changes in the endocannabinoid system with this. In addition, we talked earlier about some of those essential oils. They're here in this category, along with drugs. Things as simple as Tylenol and Motrin actually have an effect on the endocannabinoid system. So there are some effects. The problem with the drugs is that they can shift the endocannabinoid system only in one direction, and they don't have a balancing effect. So you can get the over effect of those, as well as having withdrawal effects from those other medications. Now, omega-3s are important to have in the diet because they actually have a precursor role within the endocannabinoid system. And finally, we're talking about cannabinoids, the CBD and THC. And these are also, I think, the best category is as a endocannabinoid enhancer. And with that concept, rather than me telling you that CBD is the answer for all ills, to see it as a partnership with some of the other therapies that you have available. Well, okay, who should use CBD? There's a wide range of ages that can use it. I've not seen any problem with any age, young or old. Of course, the question comes in with regard to pregnancy. I'm reluctant to say anything specifically about endorsing the use in pregnancy, but there is some evidence to show that the endocannabinoid system may be involved with some aspects of miscarriages, adversely miscarriages, and some of the difficulties in that process. And there's some studies that have shown that cannabinoids have not caused any problems. In fact, they may have improved outcomes in a number of cases. So with regard to age, I don't see any limitations on the age group. It's been safe and effective, and I've never seen a complication. And I say those young ages because I've helped treat a number of patients who with epilepsy in their young age, and they have responded very well with no adverse effects whatsoever. In terms of conditions, it's all over the map. We're finding all kinds of conditions that it can be effective for. But I think you can look at some of these different categories and think of these things as in terms of, is it inflammation? Is it immune? And I realize those are overlapping. Is it pain? What's the source of the problem? Is it a neuroprotective role and you have a neurodegeneration? Cannabidiol has been protective in all those areas. And if we're talking about irritable bowel or inflammatory bowel, it's having specific effects on the gut as well. The size of the individual just generally does not make a whole lot of difference, whether they're big or small. I generally will adjust for a child just by half or more in terms of the amount of CBD that people are using. And then for people over 70, then that may be the best approach, do a half a dose arrangement. And then when I'm asking people about their use and what they want to use CBD, it's important to find out what their level of impairment is, because if they are severely impaired, there may be some problems there in terms of choosing out which product may be ideal for them.
Could you speak really quickly, because I believe Elixinol is going to have a pet line soon. Do you have any suggestions for dogs or pets with the last slide, as far as?
Well, once again, it's not a matter of the size is not as important as getting the CBD into the person in some way. And so that's really the general challenge. I've had good results with animals, and specifically dogs and cats have responded very nicely to using the CBD. So in terms of the dosage, that's kind of variable. I think of it more of as a child's dose. So half of the regular dose may be a good starting point for the animals. Now, if you're using cannabidiol, then here's some guidelines for your deployment. Expect immediate results for most of the symptoms in minutes, hours, or days, and then you follow up early. It's very important that you follow up early on this, because people get confused about this substance and how to use it. There's lots of information in the literature, and they really don't follow directions very well. And then make rapid adjustments. Because it doesn't have any toxicity and there's just rare interactions, make adjustments. Find the right level for that individual, that Goldilocks amount that meets their particular needs, helps them and get them through and meets their particular needs. It's really important to get people to try it and get it into them in some way. And then you increase the dose to effectiveness, or you decrease it if they're showing any fatigue. And the fatigue doesn't happen very often. We're talking about 1 in 50 people really shows a fatigue issue. Now, CBD is safe, it's effective, it's non-toxic, and it doesn't have any significant drug interactions. And I want to emphasize to everybody that this is a food, not a drug. Okay, technically that may not be true, but in general, if you keep that idea that it's not a drug, then you'll be less controlling in terms of the use of CBD. And then a couple other points that I want to make with this is that CBD improves the whole person. It's the whole person who's being affected by the cannabidiol. I'll show some of these benefits in a moment that come along with using cannabidiol. CBD also potentiates some of the drugs that you might be using that often have adverse side effects in themselves, but when they're combined with CBD, those adverse effects don't occur as frequently and not as severely. So you're getting CBD's help in making the drugs more effective, at the same time protecting against those adverse effects. And I think one of the points that you have that we have with regard to chemotherapy is exactly that. And then the most common reason for CBD failure is actually an insufficient dose or not following directions. Christy, you had a case recently where a patient wasn't getting the results that she was expecting. What did you find out in that case?
My internet connection is really shoddy at the moment. So are you talking about the cancer?
Yes.
Okay. So I was talking to a woman, and she was looking for CBD to help with her husband. So we were talking about protocols and suggestions. So I asked her a few weeks later, how's it going? And I was expecting positive feedback, as it normally is.
Looks like we've lost her. But in this particular case, she said the patient wasn't responding. And it was really quite disappointing. And until Christy found out that the dose the patient was taking was on the order of 1 drop of the tincture. Well, 1 drop is a minuscule dose. we're talking about probably less than 5 milligrams. Whereas for most cancer, we're recommending typically a 90 milligrams per day. So this patient was taking way too low a dose, but didn't realize the problem. So it's a really, I think this really highlights the problem that and the role for you as providers to make sure that patients are taking the right doses in the right amount and the right frequency in order to help them through their problems. Here's a short list of the benefits that I've seen with CBD. So you get all of these things occurring, really a total person benefit list that can make a huge difference in people's lives, even if it's not for the one thing that you might be working on, whether that's pain or anxiety. If they're seeing these other things improving, then that may be the benefits that will help them. And what I've seen is that when you start to see these benefits, any of these benefits, that you really are getting a systemic effect. And it's pretty good evidence for what's happening in the CBD changing people's lives. So I've put a reference here at the bottom, and delighted to have you with me today. I'd love for us to partner, you and I, and Elixinol, because the Elixinol is the best product that I've seen on the market, and it's providing some special results. And I'd love to share more about my experiences and how you can help your patients using cannabidiol. Great. It was good to be with you and talking with you, and we'll see about getting another presentation out shortly to you. Thanks for watching.